So this topic is on lymph node examination. The contents include introduction, anatomy of lymph nodes, functions of lymph nodes, classification of lymph nodes, draining areas, examination of lymph nodes and applied aspects. Lymph nodes are peripheral lymphoid organs which are connected to the circulation by an efferent or efferent lymphatics. So these are ovoid or bean-shaped nodular formations composed of dense accumulation of lymphoid tissue which vary in size from 2 to 20 mm and average of 15 mm in longitudinal diameter. So they are about 800 lymph nodes in the body, and in head and neck it is around 300 lymph nodes. Lymph nodes are usually occurs in groups. Superficial lymph nodes are located in the subcutaneous connective tissue and deeper nodes lie beneath the fascia and the muscles. Superficial lymph nodes are gateways for assessing the health of the entire lymphatic system. Now we'll see the classification of lymph nodes. It is classified as peripheral nodes and deep cervical nodes. Under peripheral nodes, we have superficial and deep nodes. Superficial nodes includes submental, submandibular, preauricular, postauricular, occipital, anterior cervical and superficial cervical. Under deep group of lymph nodes, you have pretracheal, paratracheal, retropharyngeal and Waldes ring. Coming to the deep cervical nodes, this includes jugulodigastric and jugulo-omohyoid nodes. So this picture shows various nodes like submental, submandibular, facial nodes, preauricular, postauricular nodes, suboccipital nodes, then posterior cervical nodes and supraclavicular nodes. So let us see the drainage of the nodes. So the tissues, that is the lower lip and the tongue, that is tip of the tongue, will drain to the submental nodes, and this submental node will further drain to the submandibular nodes. And in this picture, the submandibular nodes will further drain into the jugulodigastric and middle cervical nodes. The lymph nodes in the head and neck are classified from level 1 to level 7. So we will see the levels one by one. So level 1A is all the nodes between the median margin of the anterior digastric muscle and above the hyoid bone and below the mylohyoid muscle. And 1B is all the nodes between the mylohyoid muscle, above the hyoid bone and posterior and lateral to the medial anterior digastric muscle and anterior to the submandibular gland. Next is level 2A. Level 2A is here, that is all the nodes that lie posterior to the internal jugular vein and are inseparable from the vein and lie anterior, lateral or medial to the vein. And level 2B is all the nodes that lie posterior to the internal jugular vein and have a fat plane separating the nodes and the vein. Next is level 3A, that is all the nodes between the hyoid bone and the cricoid cartilage arch and anterior to posterior sternocleidomastoid muscle and lateral to the internal carotid artery. Next is level 4. So level 4 is here, that is all the nodes between the cricoid cartilage arch and the clavicle and anterior to the posterior sternocleidomastoid muscle and posterolateral to the anterior scalene muscle and lateral to the common carotid artery. Next is level 5. It is again classified as 5A and B. 5A is all nodes between the skull base and cricoid cartilage arch and behind posterior edge of the sternocleidomastoid muscle. Next is level 5B is all nodes between the cricoid cartilage arch and clavicle and behind the sternocleidomastoid muscle. Next is level 6. Level 6 is all the nodes inferior to the hyoid bone and above the manubrium, top of manubrium, between the median margin of bilateral common carotid and internal carotid arteries. And level 7 is all nodes between the manubrium and between median margin of common carotid artery bilaterally and extending inferior to the level of innominate veins. So now let us see the local examination. In inspection, we should see the number, position, size, skin over the line, swelling, then pressure effects. And coming to the palpation, we need to confirm the inspectory finding, then look into the palpate for the consistency, whether it is matted or not, then fixity to the surrounding tissue, and then drainage area. Next is general examination. Lymph node is in other parts of the body also have to be examined. So what is the importance of knowing the age while examining the lymph nodes? Because it might hint you certain diseases like tuberculosis and syphilis and primary malignant lymphomas affect the young age. Next, about the duration, you should be clear because a shorter duration will hint you that it might be because of an acute lymphadenitis. Next, about the group affected first. Example, cervical group of lymph nodes affects first in the Hodgkin's disease and tuberculosis, etc. Whereas inguinal lymph nodes affects first in filariasis. So group which is affected first is important to be known. Next, about the pain. Acute and chronic infections are painful, whereas painless lymph nodes will hint you syphilis, primary malignant lymphoma and secondary carcinoma. Next, about to know whether the patient has fever, because evening rise of temperature is a characteristic feature of tuberculosis and periodic fever is seen in filariasis. So knowing this general information would help you in the diagnosis when there is a lymph node enlargement. So next, to know the primary focus, whenever the lymph node is enlarged, it is usual practice to look for a primary focus in drainage area of lymph nodes. So this should be done in an acute and chronic septic lymphadenitis. Then to ask for loss of appetite and weight. So because in case of malignant lymphadenopathies, this would be a common presentation in such patients. Then about the pressure effects, that is dysphagia may occur when esophagus is pressured. Next, about the past history, that is enlargement of epitrochlear and suboccipital group of lymph nodes may be enlarged in secondary stage of syphilis. Next, to know about the family history, sometime family history of TB might be reported. Next, coming to the inspection. So I've already told in short what has to be seen in inspection. So let us see little in elaborate. So about the number, we need to be clear whether it is single or multiple, because a few conditions are known to produce generalized involvement of lymph nodes like Hodgkin's disease, tuberculosis, then lymphosarcoma, then sarcoidosis. Next, to know about the position, cervical group is commonly involved in TB and epitrochlear and suboccipital is involved in secondary syphilis. So this position might hint you the specific disease. Next, skin over the swelling. So in acute lymphadenitis, the skin becomes inflamed with redness, edema, brawny and induration. Skin over the lymphadenitis due to tuberculosis and cold abscess remains cold in true sense till they reach a point of bursting when the skin becomes red and glossy. Over rapidly growing lymphosarcoma, skin becomes tense, shining with dilated subcutaneous veins. Next, pressure effects. Careful inspection must be made of whole body to detect any pressure effect due to enlargement of lymph nodes, and edema, swelling of upper limb will hint you the enlargement of axillary lymph nodes. Edema and swelling of lower limb would hint you the enlargement of inguinal lymph nodes. Then swelling and venous engorgement of the face and neck may occur due to pressure effect of lymph nodes at the root of neck. Hypoglossal nerve may be involved from enlarged upper group of cervical lymph nodes due to Hodgkin disease or secondary carcinoma. Next, coming to the palpation. So we'll have to look into the number, then local rise in temperature and tenderness. So next, about the consistency. So enlarged lymph nodes should be carefully palpated with palmar aspects of 3 fingers while rolling the fingers against the swelling. Slight pressure is maintained to know the actual consistency. Then enlarged lymph nodes may have such character like soft, either they can be elastic or rubbery, which is commonly seen in Hodgkin's disease. It can be firm, discrete and shorty lymph nodes you will see in syphilis. Then stony hard, where you will see in secondary carcinoma. So based on the consistency, you can get an idea of those diseases. Next, matted or not. So you'll have to look into the nodes whether it is matted or not. A group of lymph nodes that feels connected and move as a unit is known as matted. So I repeat, a group of lymph nodes that feels connected and move as a unit is known as matted lymph nodes, which you could see in acute lymphadenitis, metastatic carcinoma and tuberculosis. Next, fixity to surrounding structure. So you'll have to check whether it is fixed to the underlying structure. The enlarged lymph nodes should be carefully palpated to know if they are fixed to the underlying structure like skin, deep fascia, muscles, vessels and the nerves. Example, any primary malignant growth of lymph nodes like lymphosarcoma, reticulosarcoma, histosarcoma or secondary carcinoma, they get fixed to the underlying structure. First to the deep fascia, then underlying muscles followed by adjoining structures and ultimately even the overlying skin also may be fixed. Next, the draining area. Cervical lymph nodes receives lymphatics from the head, face, mouth, pharynx and neck. And one important thing we should know is left supraclavicular lymph nodes, that is virtuous lymph node, which receive the lymphatics from the upper limb and left side of chest, including the breast and also viscera of abdomen. So this is named as Virchow's node, which is named after Rudolf Virchow, the German pathologist who first described the association. The presence of enlarged Virchow node is also referred as a Troisier sign, which is named after Charles Emile Troisier, who has also described this. And now coming to the method of palpation and the location to palpate for the various lymph nodes. First is preauricular lymph nodes. They are palpated anterior to the tragus of the ear. Next is posterior auricular lymph node, which is behind the ear and on the mastoid process you need to palpate. Next, occipital lymph node, which is palpated at the base or the lower border of the skull. Next, for palpating the submental nodes, they are palpated under the chin, and then clinician has to stand behind the patient to palpate, and the patient is instructed to bend his or her neck slightly forward so that the muscle and the fascia in the regions relax. So fingers of both hands can be placed just below the chin under the lower border of the mandible, and the lymph node should be tried to be cupped with the fingers. Next is submandibular node examination. So this is there is specific method to examining submandibular nodes. That is, they are palpated at the lower border of the mandible, approximately at the angle of the mandible, and the patient is instructed to passively flex the neck towards the side that is being examined. And this maneuver helps relaxing the muscle and the fascia of neck, thereby allowing easy examination. And the palmar aspect of the finger is pushed onto the soft tissue below the mandible near the midline, and then the clinician should then move the fingers laterally to draw the nodes outwards and trap them against the lower border of the mandible. Next is anterior cervical node examination. Both superficial and deep nodes are examined. So these nodes that lie both on the top and beneath the sternocleidomastoid muscle on either side of the neck from angle of the jaw to the top of clavicle. So this is how you need to examine for the anterior cervical nodes. Then posterior cervical nodes, they extend in the line posterior to the sternocleidomastoid muscle but in front of trapezius from the level of mastoid bone to the clavicle. So this is how you need to examine for the posterior cervical nodes. So now coming to the conclusion, knowledge of regional lymph nodes is important to prognosticate the probable involvement of certain lymph node in case of known site of tumor or infection. And knowledge of regional lymph node also permits the diagnosis of an obscure site of pathologic process if a lymph node or group of lymph node is found deceased. Thank you for patient listening.